Hello and welcome to today's episode of Community Connections. I am your host, Anna Orr, and this is Community Connections airing on OROMIA11. Today we are talking all things heart health. That's right. Make sure your ticker is paying attention. This is going to be a wonderful episode with good information and hopefully giving you the empowerment you need to take care of your heart. Stay tuned. Hello, Miss Gloria, and welcome to this episode of Community Connections. I am so excited to have you joining me today.
Well, thank you so much for the invitation, and I'm excited to be here with you today.
Now, for those that are not familiar with your face and or the work of your organization, can you share with them who you are here representing in the subject matter?
Yes, well, my name is Gloria, and I am here today representing Women Heart. Women Heart is a national coalition for women living with or at risk of heart disease, and they're based out of Washington, D.C.
Okay.
I live here in the Minneapolis area.
Okay, thank you for joining me like I mentioned before. Now, for those that may not be familiar, we are talking all things heart disease because heart disease is still the leading killer of Americans. The number one, ahead of cancer. Cancer is number two, but heart disease is taking people out at a very large number. And as many of us know, that then means that it is taking out people that look more like you and me, a lot quicker than it is people that don't look like you and I.
So true.
Can you talk about the work of Women Heart and how heart disease became the focus for this woman-led organization?
Well, that was the main purpose right there, women-led, because heart disease can and does look different in women than it does in men.
Okay.
And so we are gender specific, dealing with women, and also because the symptoms and the disease manifests itself differently, and the diagnosis is actually harder in women than it is in men. So having an organization to support and uplift that is very important.
I think you're right about the focus being so male-centered. Every time you see a bus ad or something about it in a pamphlet or something in a medical office, there's a man on the front of it. There's not really a lot of focus on women. Can you talk about some of the difference, as you shared a little bit earlier, in what it looks like for men versus women?
Well, most people, the classic symptoms that you hear about, the jaw pain, the arm pain radiating down the arm, those are like classic symptoms with men. That can also happen to women, but with women, the symptoms can appear more subtly. Okay. And that's why it's so important for people to recognize that. Like one of the main signs in women can actually be indigestion. So many women may think they're having gas. They may say, "Ooh, that pizza I ate last night did not agree with me." And here it is a day, or maybe a day and a half, and that so-called pizza is still not agreeing with you. When you start to feel things like that, it's always better to be overcautious than undercautious and go and get yourself checked out, because you know you better than anyone else.
Now, viewers, please forgive me. We are talking about heart disease. Ms. Gloria, can you share with people that may not be aware what heart disease actually is? I'm familiar because I have people in my family that deal with it, but I don't want to talk above or below anyone.
Okay, well, heart disease, so many times people think they don't have heart disease. But in our communities, especially communities of color, the risk of having hypertension puts you at greater risk of having heart disease. So in our communities, over 47% of African Americans have a risk factor or have heart disease, many times undiagnosed.
That's really sad because we know that heart disease can be prevented, but it also can be slowed down if we take better care of ourselves, which we'll talk about in a little bit here. Now, we've talked about Women Heart and how it came to be, but can you talk about the touchstone that it's had in the community, some of the work that you all do as well as how you guys engage the community?
Well, we have three signature ways in which we engage the community. Number one is our website, which is www.womenheart.org, and that's WOMEN and then heart, HEART.org. So that's one way. Another way is our women champions, our heart health champions. We actually go out into the community and educate our communities and participate in health fairs and different community events and just spread the word. Because like so many other not-for-profits, so many times people have never heard or don't even know about it. And then the third way is education. Every year, Women Heart, we have a science and leadership symposium. It's a 5-day symposium sponsored with the Mayo Clinic here, and it is held in Rochester. And women from all around the country are selected and invited to come to the Science and Leadership Symposium to be trained to be Women Heart champions.
I think that's absolutely wonderful. During the symposium, are you guys talking about different ways to support women? Are you guys talking about statistics? Kind of what does that look like?
It's a 5-day training that's awesome. There are women from all across the nation, all ages, all nationalities, all ethnicities. What it does, every day it's on something different. So it is not just heart education. It talks about community. It talks about disease. It talks about disease management. It talks about a variety of things. It talks about being able to be in front and actually stand up and talk about, like a lot of people, there's a fear that says public speaking is the number one fear of most people.
I often tell people that, I'm like, it's not dying, it's public speaking.
It's public speaking. So one of the components is actually learning about how to actually, be a messenger for the organization. How can you best represent and facilitate a workshop, or how can you do media, just like I was invited here today.
I think that's wonderful. Like I mentioned, we were at the Volunteers of America Health Fair, putting community resources in the hands of residents. And you were there sharing the word about the Red Bag of Courage, which we'll get to later, as well as the work of your amazing foundation. Can you talk about how heart disease is affecting Black women specifically?
Well, when it comes to Black women, it is actually, as we stated earlier, heart disease is the number one killer of women. Most people fear cancer or dementia, but heart disease kills more women than anything else. But when it comes to Black women, we have an even higher mortality rate because of the fact that we are diagnosed later.
This is the part that I wanted to get to. I know that we talked about it just a little bit earlier in the segment, but I felt like this was the part that people can really gravitate towards. We're being diagnosed much later than other demographics. Can you speak specifically to that? I'm sorry for interrupting you.
Well, one of the things is the fact that a lot of times we don't put our own health at the forefront. Sometimes taking care of ourselves is an option when it should be a priority.
Absolutely.
So what happens, we are in a later stage of the disease when we are actually diagnosed. And sometimes not even receiving that diagnosis. Sometimes we are misdiagnosed or underdiagnosed because so many times we as women have been disregarded and told it's all in our head. We can't find anything wrong with you. Mm-hmm. It's either hormonal or it's either emotional. And so we're told to maybe just go home, get some rest. And many women go home, so-called get some rest, and they could have a heart attack or stroke because of the fact that they did not act on it. They did not advocate for themselves. So as an individual, you know you better than anyone else. So, and then another thing when it comes to us as Black women, a lot of times we'll say, I ain't got time to be sick.
That's true.
Okay. So you may know something is wrong, but you're like, I got things to do. I got to go to work. I got to take care of these kids. I got stuff that I need to do. So your own health goes on the back burner. And so whatever's going on with you manifests, and the damage continues to be done.
What do you believe is a large contributing factor to our lack of knowledge around heart health?
Well, like everything else, so many things, people think it's something that can happen to somebody else, not me. Because for some people, they think of heart disease as something that only happens to older women. Mm-hmm. It can happen to any woman at any age, at any stage in her life. Some people don't even know that someone could be born with a bad heart. So there's congenital heart disease. So you can actually start off your life being born with heart disease. So again, it's about increasing awareness and letting people know that it's important that you learn to advocate for yourself.
Can you talk about what advocacy looks like? Because I know a lot of people who prefer to bring someone with them to the doctor, or may record what they hear from the doctor, or they don't say anything in a doctor's visit because they're so intimidated, whether it be by the physician or by the language being used or even being in a medical space. And so we may not say, hey, you know, my arm has been going numb, or I've been feeling really tired, or I have a pain here or there. Can you talk about what advocacy looks like for us in the medical field?
Well, one of the things you hear all the time, if you see something, say something. Well, if you feel something, say something. Because you know you better than anyone else.
Absolutely.
Your doctor is a person, or your doctor, your healthcare provider, is an individual just like you are. And a lot of times, don't let those titles intimidate you. You have to learn how to speak up for yourself, and if not, share it with a family member. Don't be too proud to say, well, I don't want nobody, you know, a lot of times we're very private. I don't want people all in my business. We have to let that go. We have to let that go, because the life you save could be your very own.
Now, you've talked about us saving our own lives and taking better care of ourselves. What is the personal connection for you, Miss Gloria, around this work?
Well, my personal connection was in 2019. I was just living my life, doing everything that I normally do, and all of a sudden, I started being extremely tired all the time. I kept saying, okay, let me just take a nap, let me get some rest, and this will pass. But it didn't, and it kept getting worse and worse. So I said to myself, I did just like I had said earlier. I kept saying, this will pass. So I said, I'll wait until I have a doctor's appointment. So a few weeks later, I actually had a doctor's appointment. When I went to the doctor, my symptoms again had been manifesting and getting worse and worse. I started experiencing even more fatigue, shortness of breath. And so I went for my checkup. I was rushed from the clinic to the emergency room and admitted into the hospital.
Oh, no.
And so what happened, I was diagnosed with a type of heart disease that's called Takotsubo cardiomyopathy. And a lot of people say, like, what is that?
I was just about to say that's a mouthful.
Oh, okay. Okay, so as I was stating earlier, one of the things, again, was the extreme fatigue. And so when I went to the doctor, they rushed me to the emergency room. From the emergency room, I wound up being in the hospital for 9 days. So what this is a type of heart disease. What this actually is, it's a form of heart disease. And it's actually, one of the common terms is called broken heart syndrome.
Oh.
And what happened for me, I had lost 3 friends, 3 very close friends, in less than 4 months. People that I was very close to. And 2 of my friends passed away from complications of diabetes, and then another one passed away from cancer. And so after this diagnosis of being in the hospital and for 9 days, when I was released from the hospital 9 days later, 2 weeks later when I went back for my follow-up checkup, my doctor was telling me, he was like, if I had saw you on the street, I wouldn't have not known you because you look so much better. So one of the things with this particular type of heart disease is rapid decline and rapid recovery. And so this type of heart disease can be very fatal. This is the type of heart disease, I don't know if anyone knows the story, but Debbie Reynolds, Carrie Fisher's mom.
The famous actress.
Yes, who played Princess Leia in Star Wars. She died, and her mother grieved. You know, she was so devastated by the death of her daughter that the mother died the next day. And she was diagnosed. That is what's called broken heart syndrome, but the medical term is Takotsubo cardiomyopathy.
Wow. And so because of this, once you recovered, you became a part of the Women Heart Foundation?
Well, I am and have been a community health worker for many years, for over 10 years. And again, it's so important that we listen to our bodies and listen to ourselves, because I kept saying, oh, this will get better, this will get better. Because I'm very active, I do a lot of stuff in the community. I was teaching like 4 senior exercise classes a week. I had plenty of energy. I was living my life, just doing whatever. And then all of a sudden, I just started feeling tired all the time. No matter how much rest I got, I was still tired. So again, I kept waiting, because I said, I have an upcoming doctor's appointment. And I kept waiting till that upcoming doctor's appointment. And from that, I was rushed to the emergency room and then to the hospital.
Now let's talk prevention. How can we start to shift our own health so that we're preventing heart-related illness?
Well, that can be quite complex, because some people have hereditary heart disease. But other people also, too, it's important that you consider lifestyle. So if you have genetic markers for heart disease or have a family history of heart disease, you are at greater risk. It does not mean you're going to automatically get it. It just means you are at greater risk. But there are what's called modifiable risk factors that you can do something about. So those modifiable risks are things you can do in your lifestyle, such as not smoking, eating a healthy diet, getting more exercise or physical activity, and trying to minimize your stress.
I think those are very important things. And coming out of sheltering in place during COVID-19, I think these are all things that we could pay attention to, start moving our bodies more. Like you said earlier, staying hydrated, quitting smoking if you are a smoker. This is very important. Is there a test to find out if you are already pre-exposed, whether it's genetically?
Well, most people know. Because people will say, oh, well, my mom had heart disease, or my grandma had heart disease, or somebody in the family passed away from a stroke. And see, one of the things that's so important that people know is that a diagnosis of heart disease or having a history of heart disease does not have to be always fatal.
Can you repeat that again? Because I think when people hear heart disease, they immediately think their own mortality.
Well, because it can impact any person at any age, at any stage of their life. Receiving a diagnosis of heart disease does not mean it has to be fatal. You can still continue to lead a very productive life.
I think that's very important. Now talk to me about what it looks like for us to take our own power back around our own health, around our own heart health.
Well, one of the things is to speak up. Speak up and speak out. You have to share it with a family member, share it with your healthcare professionals, because again, a lot of times in our communities, people want to be oh so private. I do not want to worry nobody. I don't want people treating me differently. But again, no one can act on information that they are not aware of. So it's important that you share with your family and also share and advocate for yourself when you visit a healthcare professional.
I think that's very important. Now, talk to me and let me know one thing today that I can do to make sure that I probably keep heart disease at bay. One more day.
Well, one of the things that you can do is to start to actually try to eat a more healthier diet.
Okay.
Now, a lot of times you hear this stuff, we hear information about how it's so important for us to get more physical activity in our life. Well, the fuel you put in your body also plays a very, very important role. So the fuel that you give your body, it helps your body to serve you in its best capacity. So that does not mean that you can never have a piece of cake. It doesn't never mean you can eat fast food. But for some people, that is your whole diet. You do not eat fresh fruits and vegetables. You do not eat foods in their most natural form. So if it's not fried, dipped in batter and coated, but learning how to enjoy food for just what food is in its most natural state. Bake it, boil it, broil it, and use seasonings. Learn to use different herbs and spices to flavor your food, because healthy cooking can also be tasty cooking.
I think that's very, very true. Can you talk to me about what's in front of you, the red bag of courage? I saw that you had that at the health fair that we were at not too long ago. Can you explain to viewers what that is and what comes inside the red bag of courage?
Okay. Well, thank you. This is the Women Heart. It's called our red bag of courage. And at outreach events, we share this with people who come to our events. And inside of this red bag, there is information about different things in regard to heart disease. So we have a variety of different information here. And here are some of the things inside of here.
Talk to me about Sister Match. What does that mean?
Okay, well, Sister Match, what this is a woman who has, say, recently been diagnosed with heart disease. You may feel alone or isolated, and you may not. A lot of times we don't go to the doctor but a few times a year.
Mm-hmm.
But Sister Match matches you with another woman who has heart disease, and she can reach out to you either via phone or email or Zoom. And so she becomes like your heart sister. So it's a Sister Match program. Okay. We also have support groups, and those are also in person. But that's the difference between Sister Match and support groups.
I think that's so important because, like you said, we know that we can be so private, especially if it's something going on medically with us.
Yes.
And we won't tell anyone. And then when it's time to call the funeral home is when we find out what somebody that we know and love has been battling with. So I think that's a beautiful way to form community, but also to create support and accountability to start improving your health.
Yes, and this is another very important piece. I have heart disease. Now what? Okay? And this, again, is a talk about it's important to connect, to empower, to develop, and build. And so this is just some information inside of here, inside of the bag here, just some various different information to just help women along their heart journey. And it's just a plethora of information. And this comes inside of your bag. And our bags also come in Spanish, okay? And there's a great little bookmark that if you enjoy reading, you could put that.
I think that is beautiful, and I think that's really important. I know that I took a bag while I was with you at the health fair because there's someone in my life that is navigating heart disease, and I just wanted them not to feel alone. And they thought it was so beautiful to receive such a cute little bag. They're like, "What's in here?" And I'm like, "Just open it and read some of the information at your leisure." So I think it's not only helpful, but it's also a really loving gift to remind somebody to take care of their heart.
And one more thing I'd like to share.
Please.
We actually have what's called virtual red bags of courage.
Talk to us about that as well.
So that is the information that's inside of here, but it's virtually. So say if you can't come to a health fair, we have a variety of different information. Basically, the information inside of this bag here is basically just general information. But on the website, we have some additional information, more culturally specific.
Okay.
Like here's heart disease in African American women.
Absolutely.
There's pieces about
Hispanic and
Right.
American Indigenous women.
and indigenous women, yes.
I think that's very important.
So this is
Indigenous
culturally specific.
I
And so
think that's important. Talk to me about how we can best stay connected to the work that the Women Heart Foundation is doing.
Well, again, one of the most important things you can do is go to our website. You can get more information. You can actually request for a champion to come to your health fair, your women's group, your church, your sorority, whatever group that you might have that you would like to have someone to come out and speak and educate and actually tell you more about heart disease. And also, too, another thing I want to share, a lot of times men, they will say, this says women heart. What does it have to do with me? Well, men, all men have a mother. So you may have a mother, a grandmother, an aunt, a sister that you might want to share this information with. So it's not because it's women heart. It's not like we like men don't count. It's important that we get this information out to men to let them know that heart disease impacts women differently, but most research is done on men.
Absolutely. What is next for the Women Heart Foundation? Where will you be next, Ms. Gloria? Where can people come and talk to you and receive some of your amazing knowledge around heart disease and heart health?
Well, one of the things I do is I support my local community here in Minneapolis, and I'm always at different health fairs and just out there uplifting women heart in the community, because as I stated earlier, no one can act on information that they're not aware of. So it's just important. And also Women Heart, another thing they do is every year we have our Science and Leadership Symposium, and it's about recruiting new women to come and share within their communities, because we are a nationwide organization. However, it's important that we work toward recruiting more women of color, because so many organizations, a lot of times, we're not at the table. So again, this is the sort of thing when it comes to heart disease, no one is exempt. And as I said earlier, the life you save may be your own. So in this instance, it's very important that you learn to be proactive versus reactive and act on the information and get information that you can receive to save your own life.
Now, outside of you going to the health fairs and being a champion out in the community, as well as the amazing website that you shared with us, are you all on social media? Is there a way for people to stay connected to the work you're doing on social media?
Yes, it is. Both, yes.
Can you provide us with the social media handles and where you guys are?
Well, it's just Women Heart. You can just go, when you go to the website, you will actually see information about the Facebook, the Instagram, things of this nature.
Good.
Where you can connect to.
Wonderful. Thank you for joining me today, Ms. Gloria. This has been a wonderful conversation about a very poignant topic, and I'm grateful to know that someone like you is in the community doing such amazing work.
Well, thank you very much for having me.
Unfortunately, that is all the time that we have for our very special guest, Ms. Gloria Coles. Thank you so much for joining me today and for your amazing work in the community. Please make sure that you reach out to the Women Heart Foundation, either online, on social media, or in person if you have questions or comments, concerns about any of the information that you have heard today. I hope that you and or somebody in your network feels empowered to take their heart health seriously, because we know that this can be prevented. And if not prevented because you are genetically predisposed, please know that you do not have to go through this amazing situation on your own. As always, I am Anna Orr. This has been Community Connections, airing on OROMIA11. I look forward to connecting again with you soon.